Hello, I'm Dr. Raj B. Singh, a consultant respiratory physician at the Apollo Hospital in Chennai. Tuberculosis is a very important public health problem in the world today because we find that even now about 1,000 people die of tuberculosis every day. And it is entirely appropriate that at least one day in a year tuberculosis is observed all over the world. Now, the reason why TB is still a major threat to the health of people in the world is that even though it is a fully curable disease, it is still not recognized early enough and it is not treated consistently well throughout the world. There are a number of reasons for that. And the first, of course, is the lack of education among people and the lack of understanding of how this disease occurs and spreads among the people. We have to remember that TB is a disease which is caused by infection, which means these are germs which occur and spread from one person to another. Now, only lung TB, where tuberculosis affects the lung and produces cough and sputum, this is the disease which can spread to other people. TB, which affects other organs like bones and lymph nodes and brain, intestines, and so on. In fact, TB can affect any part of the body. Other types of TB does not really spread from one person to another. So a person with lung TB should first of all be identified to help him overcome the disease, but also importantly to prevent him spreading the disease to other people around him. So once TB is recognized, it is important that the person takes the correct treatment for the appropriate period, which is determined by the doctor. Now, some people are afraid of the medication which is used in TB because of side effects, and obviously all medication do have side effects, and anti-TB drugs also have important side effects which will be understood by the doctor and will be taken account of. Now, what is even more important to understand is that TB itself is far more serious a threat than the side effects of medication. So therefore, people should be alerted when they have a cough which is not going away for more than 3 weeks, and they may have an unexplained fever or ill health or weight loss. Any of these symptoms should alert them to the possibility of having TB and should have themselves checked up by the nearest doctor.